and welcome to Mother Care. It's always a pleasure and privilege bringing the show to you every single week. Thank you for keeping the faith and being with us for another edition of the show. My name is Marian, and honestly, I'm excited today because it just warms my heart knowing that you're out there. Thank you for all the mails, the messages, the questions. It is amazing how many people watch this show and want their questions answered. Keep them coming in. We'll ensure that the doctor comes later on the show when we have our doc and call, and he will be able to have a moment with him and he will answer all your questions, your comments, and of course the kind of topics you would like us to treat on the show Mother Care. My name is Marian. We're going to go straight into the show now. As usual, we'll have our feature documentary. That's a very short explanation of what the whole edition is about. So stay with us. You're watching Mother Care.
Abincin da na fi so, me zan yi faɗa muku akan yankukan mama na mai daɗi. Da kuma ɗan wakenta mai daɗi. Ta ce sirrinta magista wadda ake yin ta da waken soya da wa'yansu sinadaran masu inganci da yake bada ma'ana a cikin girke-girkenta. Amma ba ni da abincin da na fi so. Don duk girkin mama na da daɗi. Maggi, girki mai inganci.
Vitamin deficiency is an inadequate vitamin intake that causes a person to become deficient. It is due to not receiving the necessary level of vitamin from diet. Deficiency can also occur as a result of disease or lifestyle factor. Some common examples of vitamin deficiency include keratomalacia caused by vitamin A, beriberi caused by vitamin B1, scurvy caused by vitamin C, rickets caused by vitamin D, vitamin E deficiency and vitamin K deficiency, which causes impaired coagulation. Vitamin D deficiency causes the softening of bones in children, resulting into fractures and deformities, as it plays a key role in calcium absorption and the building of strong, healthy bones. Children between the ages of 6 months and 2 years who lack the proper vitamins are more prone to diseases if they are more breastfed by their mothers.
Welcome back. So that was our feature documentary on our topic, and it's all about vitamin deficiency in kids. Now, I know my mom used to always say that all these things that we have big long names for is because we're all giving our kids junk food. We're not giving them fruits, we're not giving them vegetables, we're not giving them the right things to eat. Now we have enough money and we are microwave moms and we give them all the junk food, and that's why they have the problems. Is that true? Well, let's talk to real moms on the street on this very real issue.
Actually caused as a result of imbalanced diet. That's when you're probably overtaking certain food, you're having certain nutrients at excess in your body, and then you are lacking in some areas.
In a society like Nigeria, where we have basically carbohydrate food on the eye side, where people consume it on the eye side, so many people don't learn to balance it up, okay, and that brings a problem where some people are either obese as a result of taking too much of fat.
Abincin da na fi so, me zan yi faɗa muku akan yankukan mama na mai daɗi. Da kuma ɗan wakenta mai daɗi. Ta ce sirrinta magista wadda ake yin ta da waken soya da wa'yansu sinadaran masu inganci da yake bada ma'ana a cikin girke-girkenta. Amma ba ni da abincin da na fi so. Don duk girkin mama na da daɗi. Maggi, girki mai inganci.
Welcome back. You're still watching Mother Care. And so now I have the doctor in the house. So she's going to educate us. We've heard what mothers think and, of course, our short report on the topic. But it's time to talk to our doctor in the house, and she will give us all the education that we need. It's a pleasure to be talking to Dr. Yeside Akingbolagbe. She's a consultant pediatrician, and I'm going to say, did I pronounce that correctly?
Yes.
Because in my head, I've been trying to practice it, but it's great to have you on the show.
Thank you for having me.
You know, when I was younger, aside, this is not part of it, but aside, I used to think every pediatrician should be female. And then the first time I had my kids, the first pediatrician I met was male. I was like, this feels wrong on every angle. But I always just felt like a female pediatrician would be maybe more loving. But the first day I got a female pediatrician, she was harder than the male one. I don't know why. But that's aside. Okay, let's talk about vitamin deficiency in kids. Okay, so we all know our vitamins, and off the top of my head, I'm thinking there should be some that probably more commonplace when it comes to deficiency in this part of the country. But vitamin D, which is the sunlight vitamin, should that be our problem? Should that even be among the vitamins that we could have a deficiency in?
Ordinarily, it shouldn't be because, like you said, being in a tropical area where we have sunlight all year round, unlike other countries where they have winter and other seasons where the sun doesn't come out like 24 hours of the day. So ordinarily that shouldn't happen, but you find out that sometimes now kids are not exposed to the sun.
Okay.
They don't play outside for so many hours, and some of them are actually covered because
of religious beliefs sometimes.
Yes, especially those who haven't started walking, and mothers have to back them. So even though they're in the sun, but because they're being covered, they end up not getting enough vitamin D, and they can actually be prone to having deficiency.
Wow. Okay, let's go to the basics now. So what are the most common vitamins that we have deficiencies in Nigeria, especially? Which ones do present to you when you're in clinic? What are the most common ones?
The most common ones, which would be the ones that are like obvious that you can see. Vitamin D, as we said, it presents with rickets, so you see those who have the bow legs or the K legs, as you would.
K legs is also.
Yes, it can present like K legs, or it may just be one of the legs that is bent. Also, some of the B vitamins could present with skin disorders. So you see some dark patches or dryness of the skin. So some vitamin D deficiencies can also be quite obvious. But most of the other ones are quite subtle, so they may not be obvious until when you've taken a history and found out about the nutrition, and you found out that the nutrition is not adequate. Then you'll be able to pin it and say, okay, probably this is due to vitamin deficiency.
Okay, so let's go to nutrition, because it seems like it goes hand in hand with this deficiency. When you say maybe nutrition is not enough or it's not adequate, we're thinking first, or maybe they don't eat enough. But is that really what nutrition is? When it comes to deficiencies?
Yeah, when it comes to deficiencies, it's more of the balance. Because you find out that a lot of people concentrate more on one particular class of food, most likely carbohydrates. Neglecting the fruits and vegetables, and that's where most of the vitamins come from. So it could be due to ignorance, the mom doesn't really know the importance, or sometimes fruits and vegetables can be quite expensive, and even the way our foods are processed. So when you eat vegetables, especially in our traditional soups, it's overcooked, and at the end of the day, you don't get the advantage, what you're supposed to get from the vitamins. They're all gone by the time the food is overprocessed.
Okay, so fruits and vegetables are very important now. Like, I'm talking like a mom right now and representing all moms out there. We know how hard it is to get vegetables down a child's throat. Like, it's like getting a thread through a needle. It's just fruits. Some of them, they can go with the fruit, but the vegetables, like, you just kill them, and we end up doing the carb thing. E.g., easier to do bread for breakfast. They're probably gonna agree for rice. Some will take yam, but that's as far as it goes. So I'm thinking of my timetable on my fridge, and I'm thinking, okay, I'm guilty, but it is so difficult. How do we go around this?
Well, the some foods are actually fortified, and that helps.
Okay.
For instance, some butters. If you look on it, you see especially the fat soluble vitamins. So that's A, D, E, and K. You could get some of them from things like butter, and then oils. So you're using your oils to cook, so they're getting some from that. With the fruits and the veg, one has to be a bit, how will I put it now?
Strict
No, not strict, but you have to, because if you're strict, they just will not eat it and leave it on the plate. So you just have to be innovative. You can cut the carrots up in shapes that would attract them. Okay. And the colors, by the time you put in the carrots, which are orange, and then maybe some peas.
My son yet. You have not made my son yet.
Don't worry now, I'm talking as a pediatrician, not as a mom, because I know as a mom it's difficult. But I think it's just starting early and then showing good example, because you find out that you are not eating, and then you're putting it on their plates and you're trying to get them, forcing them to eat it. So if it's part of the normal diet, from when they start eating solids, you introduce it early. When they are younger, you can blend. So you can blend your carrots, blend your fruits into the cereals. So at that age, they will take anything you give anyway. But by the time they start getting older, you can make it fun. Okay. Sometimes you can give rewards, if you eat your vegetables, though, well, we don't really recommend that all the time, but you can have a little piece of candy or something just to encourage them, because if you make them just say, sit down, eat your vegetables, they won't.
Yeah, it's almost like punishment, which is hard with my son because he doesn't even like candies or anything sweet. So bribing him with anything sweet is just going on in bed. But I was going to ask, what about when we have, I know a lot of moms do the, how when you're grown up, you take the tablets, the multivitamins, and then some people also, we now have all those things for children, something for kids, this for are those okay to give your kids, or should we just go the natural route?
The natural route is what we would recommend, but if for any reason, you've tried everything, especially when the children are a bit younger, they can't really reason with you, and you feel child is not getting enough, you can. But at the same time, you have to be careful, because there's also something called hypervitaminosis, which means you can actually have excess of some vitamins, which can actually be dangerous. So you have to make sure that it's the recommended. There's something that is usually written on some of those multivitamins. It's called the required daily allowance for the age. So you have to make sure that you don't go above that, and it will be better to discuss with your child's doctor so that you get the right advice and don't just go giving the adult dose to a child.
Are there any signs? I know there's some obvious signs like you said, but are there early signs for moms to think, could this be an issue? Could my child have a deficiency with vitamins? Are there early signs, and then that makes us go quickly before it gets to the signs that are obvious and permanent?
Yes. So for something like rickets, that's the vitamin D deficiency. Before you start having the obvious like bowing, you could have some swellings at the joints. Okay. So the elbows, the wrists and the knees, you could start seeing a little bit of swelling there. Along the ribs, you could also start seeing some swelling of the bone. So that can give you an early sign. Okay. And then for some other ones, you can start seeing blisters on the tongue, on the mouth, at the edges of the mouth as well. Then skin changes, you can start seeing some dryness, some patches, even hair changes. The hair color can start changing as well. Okay. So those are some subtle signs. Even things like diarrhea can be due to vitamin deficiency, lack of concentration, child always getting tired. These are all early signs that you can pick up.
Okay, what about those the child getting tired? Okay, aside from the fact that could be some excuse for not doing your homework, but we should take it seriously, because sometimes moms just think you just don't want to do your homework, or you just don't want to go to school. But that could be a sign. Is that enough? Is that enough for me to get to the doctor? Yes,
it could, because it could be the child could have low blood level. It could be anemia, and if you have vitamin C deficiency, absorption of iron will be less. The child could have anemia, and that could be the cause of the tiredness. So I think you should listen to the kids. Anything they say, don't take it lightly. Investigate, and if there's nothing wrong, then you leave it. But it's not good to ignore, because if you pick it early, you can actually make a difference.
Okay, thank you so much, Dr. Yesterday. I've learned quite a bit today, quite a bit today, and I think I've learned the fact that you just have to go the natural route. It's actually better, easier, and safer. Yes. Thank you so very much. Okay, we've been talking to the doctor on vitamin deficiency, and I do hope you've learned a few things. And I know moms out there, it is hard, but one thing she said was, by example. So if you do it and make it seem like it's so much fun, they just might try it. I know it's not so easy, but you know what? Let's give it a whirl this week and see how far we go. Take a short break. When we come back, the doctor will be, well, Dr. Clement, that is, will be here answering all your questions on Moments with the Doctor.
Abincin da na fi so, me zan yi faɗa muku akan miyan kukan mama na mai daɗi. Da kuma ɗan wakenta mai daɗi. Ta ce sirrinta Maggi Star, wadda ake yin ta da waken soya da wa'yansu sinadaran masu inganci da yake ba da ma'ana a cikin girke-girkenta. Amma ba ni da abincin da na fi so. Dan duk girkin mama na da daɗi. Maggi, girki mai inganci.
But we are going to take out a little time this episode to discuss something that is still there, but we may think they are not there or it is not there. In fact, my director said I shouldn't wear red scrub because what I'm talking about is red. So I decided not to wear a red scrub. Let's go green. No, let's go green. So what are we talking about that is red? I'm talking about COVID-19. What do you think? Do you think that it is still a myth? It is not there. It's American disease. It is that and this. Is that what you are still thinking? Do not think like that, because COVID has come to stay with us. It is not just there, it has come to stay with us. We are not interested in controversies, whether what is the number, what is this, where are they seeing it. That is not the issue. The issue is that the disease is there and is killing a lot of Nigerians. Do you try to do a comparison with the mortality rate in Nigeria and you compare to the United States? Well, you will not be doing that, because if somebody loses a loved one in death, to that family it is 100%. It is not the percentage we are calculating. So we are going to take our time to talk about COVID as what we know today and how we can present ourselves. We have come to know now that COVID is that viral disease that affects our lungs and give us a form of pneumonia-like symptoms. Cough, catarrh, sneezing, chest pain, loss of smell, loss of taste, fever that does not go. It could have other secondary symptoms, diarrhea, and just name it. These are the symptoms. And it becomes even worse with people who already have underlying medical condition like pneumonia, like we talked about pneumonia. Of course, it will come because anything that affects the lungs will present like that pneumonia that could lead to heart failure, clotting disorder, and so many other things that we have read or either seen. Do you think that you have not come in contact with COVID patient? You cannot tell, because our behavior could predispose us. Would you ask me as a doctor if I have? Yes, I have. I have, of course. My work would have exposed me to the ones I know and to the ones I don't know. One of the questions we had was, if I have COVID, what do I do? I just laughed and said, if that person actually have COVID, he will not be asking me, what should I do? Because he know what to do. Go to an isolation center. If your symptoms are the one you can manage at home, then you isolate yourself so that you don't distribute it to your loved ones. Now, what are we expected to do to prevent spreading COVID or not to take it? Now, use your face mask. Face mask, you can make your face mask with your fabric, cloth. When you do, at the end of the day, wash it very well, dry it so that you use it the next day. If you are using the surgical or the non-surgical face mask, you use, after the end of the day, you dispose it and then use another one the next day. Wash your hands very well with soap and water. Use sanitizer. When you want to cough, you cough into your elbow, you sneeze into your elbow, you clean with tissue paper or you sneeze with tissue paper and dispose it appropriately. Then social distance. Give a distance that is safe so that if somebody cough, it doesn't get to you. Or if you cough, it doesn't get to other people. Avoid crowded area. If you are in a crowded area, then use your face mask. Listen to what the government and the guideline, WHO, CDC, NCDC, the guideline they give to us. That can keep us safe. That can help us to prevent COVID. Well, the vaccines are said to be available now. When we have more details about the vaccines, we will come back to discuss it, and of course you make an informed decision, informed consent, whether you're going to take the vaccine or not. And the government, of course, will also direct us on what we should do about that. Take note, my dear viewers, that COVID-19 is real and is going to stay with us for a very long time. It is not a myth. It is not American disease. It's not a story they tell. It is here with us, but you be responsible by taking care of yourself and thus not spread this deadly virus to your loved one at home. Remember that our aim in this program, Moment with Doctor, we share this moment to educate you, to enlighten you so that you are healthier. Till next week, when we have opportunity to enlighten you, please stay safe and remain blessed as I remain Dr. Clement, your uncle, the man and the doctor who is interested in your health. Remain blessed.
Abincin da na fi so, me zan yi faɗa muku akan miyan kukan mama na mai daɗi. Da kuma ɗan wakenta mai daɗi. Ta ce sirrinta Maggi Star, wadda ake yin ta da waken soya da wa'yansu sinadaran masu inganci da yake ba da ma'ana a cikin girke-girkenta. Amma ba ni da abincin da na fi so. Don duk girkin mama na da daɗi. Maggi, girki mai inganci.
Hand washing. It is the act of cleaning the hands with soap and water to remove harmful and unwanted substances stuck to the hands and kept dry to prevent recontamination. Hand washing with soap can help children grow, keep food safe, and reduce the transmission of a range of diseases such as diarrhea, cholera, hepatitis E, and acute respiratory infections. When you prepare food, before eating, after using the bathroom or toilet, or after coughing and sneezing, caring for someone who is sick, or touch an item or surface, remember to wash your hands with soap under clean running water. Hand hygiene for all highlights the importance of hand washing with soap during the COVID-19 pandemic to fight against COVID-19. To beat the virus today and ensure better health outcomes beyond the pandemic, governments, businesses, institutions, and individuals must make hand washing with soap for all a priority now and in the future. To wash your hands, wet them with clean running water and apply soap. Lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. Rinse your hands under clean running water and air dry your hands or use a clean towel. You can use an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water are not available.
Well, that's been the show today. Our topic was vitamin deficiency, and I forgot to tell you one little trick that you can do for your kids when it comes to vegetables. Cut them really, 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 really small. Okay, so when you mix it with the rice or something, even though they want to pick it out, it is so much work. It is like jam question to pick it out, and so they will have to eat it. So that is something I did. Doesn't mean, Mom, cut it very, very small. They can't pick it out, and they will have to eat it. So that is a trick. But remember, the natural route is always better. That's why our parents didn't have so many problems with us. But then now we want the microwave, just pop a pill. Let's go the natural route. Thank you for all questions. Thank you for all comments. We would love to really, really hear from you every single week, and we'll take your questions and comments. And of course, your suggestions on topics to treat on the show is always welcome. My name is Marian. It's been a pleasure always bringing the show to you and to every mom out there. Being a mom, best job in the world. Thanks for watching.